After working under the classic orthopedic model for a number of years, it became very clear to me that it has shortcomings. Clearly, opioids administered chronically or repeated cortisone injections are not really the answer to chronic problems. Maybe in an acute situation, those could be used very successfully, but for patients with chronic problems, chronic pain, chronic lumbar or back problems, etc., opioids and repeated cortisone injections are mostly ineffective. So because of that, I started looking at the regenerative medicine model of treatment, which is a departure from the classic orthopedic model of anti-inflammatories, surgical removal of tissue, or joint replacement. I found that regenerative medicine is actually as successful, if not more successful, and definitely more cost-effective than the classic orthopedic model. And I started very simply with proliferative therapy, which has been around for 100 years or longer, right? And after using proliferative therapy for a number of months or years, then we moved on to platelet-rich plasma, and then we moved on to stem cells and placental-derived tissues, and that's where we are right now. So my interest in regenerative medicine was born out of the frustrations I had with the classical orthopedic model and just seeing that the patients were simply not getting better. Once I started using regenerative medicine, then I realized that the success of regenerative treatments is really predicated upon the health of the patient. If you just inject stem cells in somebody's arthritic knee and the person is actually sick or chronically ill, they will not respond to the regenerative treatment. So it became pretty clear that we have to also improve patients' overall health for our regenerative treatments to become more successful. And this is how we got to do regenerative medicine with a functional medicine bias.